Welcome to NCLEX Map, where knowledge meets clinical precision. Today, we're diving into the ABC framework, focusing on circulation, the pulse of life. Airway and breathing are just the beginning. Circulation is what delivers oxygen to every cell in your body. Circulation is all about the continuous movement of oxygenated blood. When blood flow slows or stops, tissues can die in minutes. Perfusion isn't just a number, it's life reaching every organ, and it's crucial for survival. According to the AHA and Lewis Medical Surgical Nursing, maintaining circulation is key to preventing shock and organ failure. As nurses, we must recognize hypoperfusion early and act without delay to save lives. Start with assessment. Check blood pressure, pulse rate, and quality. A systolic below 90 or MAP under 65 is a red flag. Look for cool, clammy skin, weak pulses, or delayed capillary refill. These are all warning signs of poor circulation. Watch for chest pain, irregular rhythms, dizziness, or confusion. Altered mental status can be the first sign of low cerebral perfusion. Remember, the brain is the most sensitive organ to hypoxia, so we must act fast. Major causes of circulatory collapse include hemorrhage, dehydration, myocardial infarction, arrhythmia, sepsis, and anaphylaxis. Each of these conditions requires rapid recognition and targeted intervention to prevent serious outcomes. In cases of hemorrhage or hypovolemia, restoring volume is the first step. Insert a large-bore IV and start isotonic fluids like normal saline. Apply direct pressure to bleeding sites and monitor vitals every 5 minutes to ensure stability. For cardiac issues like MI or arrhythmia, follow the MONA protocol. Morphine, oxygen, nitrates, aspirin, in that order when prescribed. Obtain an ECG immediately and prepare for advanced cardiac care to address any complications. In anaphylactic shock, stop the trigger and administer IM epinephrine first, followed by oxygen, IV fluids, and antihistamines. Never delay epinephrine when airway and circulation are compromised. It's critical for survival. For sepsis, remember, cultures, antibiotics, fluids. Draw cultures before starting antibiotics and begin broad-spectrum therapy. Infuse rapid fluids to stabilize the patient. Early recognition can dramatically reduce mortality rates. Continuously reassess your patient. Check skin temperature, urine output, and mental status regularly. If urine output drops below 30 milliliters per hour, it's a sign the kidneys aren't being perfused. Alert the provider immediately. In cardiogenic shock, be cautious with fluids as they may worsen pulmonary congestion. Use vasopressors or inotropes as ordered. Positioning matters. Lay the client flat with legs elevated unless contraindicated to improve venous return. Assess for cardiac tamponade after trauma or surgery. Look for muffled heart sounds, JVD, and narrow pulse pressure. This is an emergency. Monitor for DVT in immobile clients. Assess for unilateral leg swelling, pain, and warmth to catch it early. Prevent DVT with compression devices and early ambulation. Never massage a suspected clot as it can dislodge. Scenario 1. A postoperative patient with BP 88 to 50 and HR 128. Activate rapid response, infuse fluids, and check the incision. Internal bleeding is a concern until proven otherwise, so act quickly to stabilize the patient. Scenario 2. A septic client with fever, tachycardia, and MAP 60. Draw cultures and give IV fluids and broad antibiotics immediately. Recheck lactate and urine output to evaluate the response to treatment. Timely intervention is key. For NCLEX reasoning, prioritize interventions that restore perfusion. When you see terms like bleeding or weak pulse, think circulation first. Avoid traps. Don't give analgesics before stabilizing vital signs, and don't elevate legs in suspected fractures or pelvic trauma. Evaluate outcomes. Rising BP, stronger pulse, warmer skin, and returning urine output are all signs your actions are working. If things aren't improving, escalate care and prepare for advanced support to ensure the best outcomes. Evidence from AHA, ACLS, and other resources confirms that early recognition and fluid resuscitation save lives. As nurses, we are the guardians of perfusion and stability, so let's keep our patients safe. Remember this core truth. Airway and breathing mean nothing without a beating heart. Maintain the flow and support the pump. If this lesson helped you connect cardiac science with clinical judgment, share it forward. Like, subscribe, and follow NCLEX Map. Together, we breathe, circulate, and care, because every beat counts.